So, doctor, tell us about the mind-gut connection and why it is so important to literally go with your gut and to listen to what your body may be telling you.
Yes, well, in terms of the mind-gut connection, I think anyone who's experienced butterflies in their stomach, which I think we all have at one point or another, understands that there is certainly a connection between our mind and our gut, and the fact that that's where we often experience stress or anxiety or even excitement. But when I say trust your gut, what I mean is you should really listen to what your gut is telling you in terms of any symptoms that are bothering you that could be a sign of a deeper underlying condition.
So how can we tell if stomach issues and other GI-related symptoms are the sign of something that should be shared with your doctor or just everyday, ordinary gas or whatever?
Yeah, well, it's a great question because it can be a little confusing, and we all from time to time will have a little upset stomach. Maybe we ate something that was a little off or we went traveling. But if you're having persistent symptoms that are really affecting your ability to work or have a life, this is a reason to certainly see your doctor. And these symptoms could be things like abdominal pain, gas, like you said, bloating or diarrhea. And what can be confusing is those symptoms could be a sign of many different GI conditions, things like irritable bowel syndrome or Crohn's disease, but it also could be a sign of a condition called EPI, which a lot of people are not aware of.
All right, so what exactly is EPI and what are the symptoms?
Sure. So EPI stands for Exocrine Pancreatic Insufficiency, and this is a term that means your pancreas is not producing enough of the enzymes that you need to digest your food and break it down into the nutrients that you need. And some of the symptoms of EPI are things like bloating, abdominal pain, diarrhea, unexplained weight loss. Because you're not digesting fat very well, you might actually see fat droplets in the toilet when you go to the bathroom. Your bowel movements may float to the top. These are some of the symptoms that could be associated with EPI.
And so what should we do if we're experiencing these symptoms?
Well, you definitely should speak to your doctor, and specifically a gastroenterologist would be a great person to go to really get the correct diagnosis of what's going on with these GI symptoms. And, if you do have EPI or you think you might have EPI, there's a great resource, identifyepi.com, that has a lot of great information, including a wonderful symptom checker.
How important is it, again, if I could follow up on talking to your doctor?
Sure.
Because isn't one of the issues that a lot of us, when we're experiencing that gas or that bloating, we just reach for an over-the-counter whatever to take, antacid or whatever, when, like you said, the issue could actually be something more serious. So how do we get over our embarrassment, really, to talk to a doctor? Hey, doc, I've got gas, or I'm bloated. How do we get over that embarrassment to talk to our doctors about these things?
Yeah, I'm so glad you brought it up because these are topics that people often feel shy about discussing. But understand, and I'm telling you as a gastroenterologist, we've heard it all before. This is what we talk about day in and day out. Gas, diarrhea, all those things that maybe your mother told you should speak about in public. You need to, because it's really your right to feel well and enjoy your life. And many of these symptoms can really affect, your ability to feel well. And self-medicating and taking over-the-counter medicines for long periods of time without getting a correct diagnosis is a mistake, because some of these conditions, not only can they affect your well-being in terms of how you feel, but can have some long-term serious consequences. So you don't want to go undiagnosed. You want to get the right diagnosis from the right doctor and get the treatment so that you can feel much better.
And if I could ask one more question on following up on that, what do we consider long-term? Like how long, if a person is experiencing gas or bloating or diarrhea, like you say, is it 24 hours, 48 hours, 72 hours? What's the...
Yeah, I would say that sometimes if you eat something off or you get a bug, it could last up to 72 hours. If it's persisting more than that, I would definitely speak to your doctor.
Great. And finally, give us that website where we can get more information, please.
Sure. The website is identifyepi.com. And again, there's a symptom checker there. There's a lot of information about this condition, questions that you can bring with you to go to your doctor. So a lot of great resources.
Well, Dr. Raj, thank you so much for joining us today.
Thank you. It's my pleasure.